Hello, and welcome to our session on elevating family voice in Part C and Part B 619 programs at the 2021 OSEP Leadership Conference. We're so glad you have chosen to watch our session. I am Mary Lee Porterfield from the Center for IDEA Early Childhood Data Systems, also known as the DaSy Center, and I'm facilitating this virtual roundtable discussion with leaders from North Carolina's Part C program, their 619 program, and their parent center, the Exceptional Children's Assistance Center, which you will hear us referring to as ECAC. These panelists have done some remarkable and inspiring work in the family engagement space, and they have graciously agreed to share with us their vision, strategies, and lessons learned in elevating family voice in their work. To kick us off, I turn to our panelists and have them introduce themselves and say a little bit about what brought them to or inspired their focus on families as partners in their work. Let's start with Dawn.
Hi, everyone. My name is Dawn Meskil, and I am one of the 619 co-coordinators for North Carolina. And for me, this is really about working collectively and truly lifting up the family's role in the life of their child and the value their perspective brings to our work. As a young teacher, I have no doubt that I unintentionally centered my point of view over the families I served many times. And as I took the opportunity to listen more and learn from families, I realized how much stronger our educational systems and practices are when we include family voice. We have so much to learn from families, and we must intentionally embrace that opportunity.
Hi, my name is Beverly Roberts, and I am the Family Engagement Manager for the Exceptional Children's Assistance Center, also known as ECAC, the Parent Training and Information Center for North Carolina. For me, I will always remember what it felt like the day my son Charles Eric was evaluated, and I heard the diagnosis for the first time. As Charles lay asleep in my arms, the evaluators were saying things like, retarded, he will never, the gap will widen. I felt like my voice was being drowned out and my voice went silent. I will forever be grateful for the folks along the journey that helped me find my voice and the courage to use it.
Okay, hi, my name is Sharon Loza. I'm the Part C coordinator for the North Carolina Infant Toddler Program. And can I just say, wow, whenever I hear Beverly speak, I'm so touched, and it reinforces how important it is for us to be hearing that family voice. So what inspired me about the focus on families as partners is my passion for ensuring that we're serving families and making that positive impact on children and families. And the facts are that parents are not only a child's first and best teacher, but are the voice who can tell us about their experiences of receiving services. If we want to do best for our families, then we need to know what is best. And we can only do that by being with them, hearing them, and partnering with them.
Well, Sharon, I'm going to echo your comments on Beverly. What Beverly has shared with us, that really is a powerful reminder of the imperative for us family voices in work. Beverly, I'm so glad that you were supported to share your feedback and to be able to lift your voice. And that kind of work is exactly what we're here to talk about today. The family engagement work that our panelists are engaged in grew out of data that showed them the changes that were needed in terms of family voice and how it was solicited and supported in state planning. Sharon, could you start us off by telling us about some of the ways that family voice is incorporated into the Part C activities?
Yes, I would love to. Thank you for the invitation, Mary Lee. So I'm going to share a little bit about North Carolina's State Systemic Improvement Plan in our Part C program. As part of that work, we convened various work groups to examine system changes that could enhance and support services to our families. A couple of groups we convened focused on family engagement and another one on evidence-based practices. These groups had cross-sector representation from many sectors, including participation from our partners at the Exceptional Children's Assistance Center, which is North Carolina's Parent Training and Information Center, as well as partners at Part B. Our evidence-based program work group helped us guide our decision to implement professional development around family coaching and implementation of the pyramid model. We'll hear more from Dawn about this a little bit later in our session. Where I'd like to focus is the team we convened around family engagement. And we explicitly focused on our family outcomes, or in Part C, our federal indicator number 4. In this cross-sector work group, we were charged to identify strategies to increase response rates and family voice in the program. Again, ECAC was a critical partner in this work. And through the work we collectively did, we were able to not only revise our family outcomes survey, which is the way we gathered our data for that federal indicator, but we also implemented strategies that would increase the ways we were able to receive and hear family voice. As a result of this group, we adopted a more family-friendly survey. We added and enhanced the survey to add a place where families could provide qualitative feedback about their experiences. And we also increased the methods that we could receive family input. We previously used to just mail the survey, and with this new process, we were now able to offer families the option to still complete it by paper, but it being handed directly from their service coordinator, the option of completing it via a link online, and now we're also including an option for parents to be able to call in to be able to provide their feedback. As a result of all of these changes, not only were we able to see our response rates jump, but we also made substantial progress on the representativeness of our responses. At the initial implementation of that, our response rates jumped from 13% to 50% at its initial implementation. And like I mentioned before, our representativeness also went up, where to the point where our response rates are representative of the population as a whole we serve in the state. So while this was a tremendous success within that work group, our family engagement group also recommended that we conduct focus groups because we wanted even more meaningful and authentic information from our families. Our partners at the Exceptional Children's Assistance Center from Beverly Roberts, who we'll hear from, stepped in to lead and facilitate these focus groups, which were a great success, and to hear about those family experiences during their time in the North Carolina Infant Toddler Program.
Wow, thanks, Sharon. There is a lot of collaboration going on with families in North Carolina's Part C program. It's really inspiring. And it sounds like the ECAC has really provided that link to families and supported the collaborative work in very important ways. Beverly, could you tell us a little bit more about the work that you and your agency have done to facilitate and support the state's family engagement efforts?
Yes, thank you. ECAC coordinated and facilitated focus groups in partnership with the Infant Toddler Program and the Children's Developmental Services Agency, also known as the CDSAs, across the state. This was truly a team effort. ECAC created the recruitment flyers, took care of the registration, facilitated the focus group, and created a comprehensive report that went to the Infant Toddler Program leadership, the CDSAs, and families. The CDSAs helped with recruitment by disseminating the flyers to families, helping us to secure a location for the focus group. They reviewed all the materials and consent forms and flyers because we wanted them to have opportunity to see what we were sharing with families. They also were very much a part of all the planning meetings to create the protocol for the focus group. This might sound like a lot, but once we created the materials and the protocol, we were able to use them at all the focus groups. Through these collaborations, we support families in identifying needs, such as through the focus groups and survey, and to promote those best practices that increase family engagement. I'd like to share another example of the collaboration and the data from the focus group. And this new data led to new strategies based on the needs of families. The reoccurring theme throughout the focus groups were the concerns that families had about transitioning from early intervention to preschool services. This is what some of the families said. I want to get prepared for transition because I feel like all these people, they're leaving us. You know, the transition out of early intervention into the school system is scary, especially because I've heard horror stories about what the school will provide. But my coordinator went with me to my IEP meeting. My husband was unable to go. She went with me and she was asking questions that I didn't even think to ask. So just having that was really great. I asked about transition because honestly, I feel helpless, knowing what's what and what's going to happen next. I am sick, overwhelmed, I'm frustrated with the district and didn't have no clue how this was going to work out. So based on that data, And in collaboration with the CDSAs and the LEAs, the local education agencies, we piloted 2 transition trainings. These trainings included an overview of the transition process and a question and answer panel. The CDSAs were comprised of the panel, also the local education agency, preschool specialists, and a family member whose child is in the process of transitioning or recently transitioned to preschool. I tell you, the star of the training were the panelists. At both of the trainings, the panelists were upfront, engaging, transparent, and frankly real. My first thought after the training was, now this is how it's done. And I'm not giving credit to AC for that, because all we did was bring that panel together and they created the magic. And for some of these families, this was their first interaction with their LEA preschool program staff. The feedback from the training was positive, and we had helpful suggestions for improvement. Of those families that responded to the evaluation of the training, 100% reported that they had a better understanding of preschool services, and 83% responded that they felt better prepared to participate in the transition process. After the training, we had debriefing sessions, were scheduled virtually with the team to review the data, discuss what went well, and what needed improvement, as well as formulate a next steps plan. The teams, we're looking at how best to maximize the training in reaching more families, how to provide the additional support to the LEAs and CDSAs in utilizing this training, and exploring the different formats for the training, and also what kind of follow-up we need to do with families. Another project I'd like to mention that we're so excited about is the Preschool Development Grant and the work to support family engagement in leadership opportunities, such as with the State Interagency Coordinating Council and the local Interagency Coordinating Council, to provide family-friendly resources and trainings that will help families as they transition from early intervention to preschool and preschool to kindergarten. To provide information to the LICCs on best practices for engaging families. ECAC has also had the opportunity to be a member of the state's Systemic Improvement Plan external stakeholder group and helped in recruiting families as members on that group, as well as we are currently recruiting families to participate in the creation of the new state performance plan. ECAC has also participated on the North Carolina Initiative for Young Children's Social Emotional Health and Development Work Group for Part C and Part B, as well as the North Carolina Pyramid Cross-Sector State Leadership Team. As a parent organization, we certainly know how critical it is for the family perspective to be at the table and to be heard.
Wow. Thank you for sharing all of that amazing work, Beverly, and particularly for including in this presentation. It is always good to be reminded of families' experiences and ideas. It sounds like the Exceptional Children's Assistance Center has been able to really meet families where they are, address barriers to their participation, and establish connections between families and program staff to prime ongoing collaboration. That's really great. We've also heard about your collaboration with both the Part C and 619 programs, and I think we would like to hear more about this collaborative work in the 619 program. So Dawn, we'll turn to you.
Yeah, absolutely. I'd love to tie in a few Part B connections to the efforts that Sharon and Beverly have already shared. So one example I'll share relates to the Part B State Systemic Improvement Plan, which focuses on increasing the 5-year adjusted cohort graduation rate for students with disabilities. That may seem like a stretch from the work that Sharon described for Part C, but 619 is embedded in the Part B plan through our preschool pyramid model implementation. Knowing that successful school experiences begin in the early years, our pyramid implementation is part of this effort to support graduation for students with disabilities. Beverly supports our state systemic improvement plan team by making sure a family perspective is present. And as she mentioned, she sits on our cross-sector state pyramid leadership team. So she's able to help us connect these dots on an ongoing basis as we consider family voice across Part C and Part B, as well as within the various sectors that serve our children and families. For the local preschool programs, our successful pyramid model implementation is important to ensure access to inclusive environments, support successful transitions, and reduce suspension and expulsion rates, which are all federal reporting indicators too. While much of this work happens in the classroom, none of it could happen without strong partnerships with families and understanding what it means to them to have their child included, to see their child thrive in a new setting, or to know that despite behaviors that might challenge a teacher, their child is not going to be removed from the classroom. So also the efforts to support positive transitions from Part C to preschool and then from preschool to kindergarten that Beverly described are so important to our efforts to support graduation, beginning in the early years. Knowing that families are struggling with negative perceptions and experiences as they transition is alarming and creates unnecessary compromise as a child enters LEA services. So with ECAC's support, we've been able to collectively better understand that family perspective and in turn implement strategies to support more positive experiences as children start their school years. So ultimately, Beverly and ECAC help us stay grounded in the why of this data collection, analysis, and use, and what our resulting actions really mean for children and families.
Thank you so much, Dawn. As we begin to wrap up this session, we want to encourage you to attend the live roundtable discussion that we will be a part of on July 22nd at 1:30 p.m. Eastern. There you will be able to ask questions and get more details about the initiatives that we have discussed here today. Now I ask each of our panelists to share the key takeaway points or advice you might give to state or system leaders interested in engaging in this type of collaborative work with families. And let's start with Beverly.
Thanks. I think that if you want to effectively engage families, whether at the state, local, community, or program level, we've got to be present. We've got to show up. And by that, I mean, we've got to listen. And that also includes those of us at parent centers who help families advocate for their children. We've got to meet families where they are. Sometimes that's physically and other times emotionally. We've got to respond in a meaningful and equitable manner and delve a little deeper to find out, what do we believe about families? What are our core beliefs and values around family engagement? And I would just like to recommend that if you want to explore a little bit more in terms of core beliefs, engaging families, I recommend Beyond the Bake Sale by Karen Mapp, Ann Henderson, Vivian Johnson, and Don Davies. I also think it is important for us to recognize the role that trust plays in engaging families and bringing them to the table. I ran across a training a couple of years ago, and I can't remember who did it, but it talked about 3 questions families need answers to in order to be able to engage. And part of the challenge with those questions is families will never come up to you and ask these questions. Parents have to see the answers in what we say, don't say, and what you do. I bet you're saying to yourself, what are those 3 questions? Those 3 questions are, do you see me? Do you care about my child? And can I trust you? And we need to often review how we are answering those questions for families.
Mm-hmm. Yeah, absolutely, Beverly. Thank you. I'm taking notes as you speak for my own work. So I'll also share a few lessons that I've learned that I hope would be helpful to others. And first is to really listen and observe with a flexible mind and try not to be intimidated or worried about what you might hear. You know, some of the feedback that Beverly shared from families about their experiences entering preschool services, you know, stings a little, but you can't really make progress without embracing the truth, right? And so don't be afraid to really listen. So when we do our work, we must pay attention to who's present and who's missing and why, and then really sit back and make sure that we're taking the steps needed to get those who are missing to the table, offering those opportunities in really unique and thinking outside the box kind of ways, and really recognizing that we can make impacts in many different ways. We really can be flexible. And then finally, for me, as Brian Stevenson encourages, I think we need to make sure in these leadership roles that we're considering our own proximity to the experiences of families and children at the state level or in any leadership level, we can very easily get too far removed if we're not careful.
Thanks, Dawn. Thanks, Beverly. And I can't agree more with all of those comments, how moving and how real they are. And I think if I just had 3 takeaways, I would keep them pretty simple and just say to be patient. It takes time to establish those trusting, authentic relationships. It also takes patience to work in our systems and with our system partners and to understand truly what's going on to be able to be responsive. So patience. I think the other thing is to be persistent. I think in our day-to-day, so many of us have competing priorities and demands pulling us in many directions that oftentimes it's easy to just let things fall off the radar. But we know that persistence is the key to making progress, and we need to be persistent in reaching out and partnering with our families. And I think finally, in essence, be partners. Partnership means having a two-way relationship between people who agree to share responsibility to achieve those goals. That's sharing responsibilities. We can't do this work without our families helping us know how to best support them and their children. Partnering with our families is the optimal way to ensure that we help children and families themselves meet their best outcomes.
Wow, thank you. Well, the time has flown by and we know that we have covered a lot of ground. So before we go, we want to note that we have provided a handout of resources for engaging in this kind of work, as well as contact information in case you have direct questions for any of us. That handout should be available on the OSEP conference website where you accessed this recording. Thank you for taking the time to attend this session, and thank you, Sharon, Beverly, and Dawn, for sharing the great work you're engaged in to lift and include family voices in state level work. Remember, you can access technical assistance on this topic and on many more topics through the DaSy Center simply by reaching out to your state technical assistance liaison or by contacting me directly. And finally, we thank OSEP for the opportunity to participate in this conference, and we acknowledge that the views expressed and the content of the session are our own and do not necessarily represent the policy of the Department of Education, and you should not assume endorsement by the federal government. Thanks, everybody. Bye-bye.
Bye.